New federal laws and a bigger budget will expand benefits and care for Hawaii's veterans. KITV4's Paul Drews interviewed the VA's Deputy Secretary today and reports on what veterans can expect for the future.
Billions more in the Department of Veterans Affairs budget means more staff and facilities, according to Deputy Secretary Donald Remy.
You can't provide the 21st century veteran the world-class health care they deserve in 20th century facilities.
He took a tour of the VA's Pacific Islands Healthcare Campus next to Tripler Hospital and had high praise for the care being offered in the islands. Now, even more veterans will be eligible for that care.
We have 9 million veterans plus that are using our VA facilities, our services, and receiving benefits, but there are 18 million veterans across the country.
Under the PACT Act, coverage has been expanded for veterans exposed to toxic chemicals and brings in more veterans from the Vietnam War era through the Gulf War and post 9/11 vets. Another focus will be on more mental health services for former service members.
And we need to make sure that all of our veterans have access to that mental health care when they need it. Not after they need it when it's too late, but at the point in time that it's needed, whether it's preventative or it's crisis.
One of the issues this and other VAs have had in the past is making veterans wait for care. While some of those times have been reduced for services, there are others where veterans are still waiting weeks to be seen.
We need to make sure that we have access to that care when we need that care. And some have expressed concern around wait times.
For established patients at the Spark Matsunaga VA Medical Center, the wait time to see the cardiologist is now 17 days. But for new patients, that wait time jumps to 53 days. For gastroenterology, times double, with new patients having to wait 3 months for care. Because of the long waits and problems during the pandemic, some veterans put off their appointments and their health.
For the last 2-3 years, they don't have an appointment. They haven't been in. They haven't been seen. And so there's some frustration there.
One way to reach more veterans is through the use of telemedicine, which was greatly expanded during the pandemic. And the Deputy Secretary says it is here to stay.
We can reach veterans where they are. We can provide them the care that they need, even if they are not coming into our facilities. And so
expect more facilities and VA staff under the new budget. But Lazarus would also like to see more awareness of veteran benefits, so they'll be able to take advantages of the services now available to them.
Some of these guys, you'd be surprised, so they're not enrolled in the VA. And so as much as we can do to get them enrolled in the VA so they could be taken care of is what we want to do. And here in